Let's take a look on Anion gap. Now, Anion gap is not only asked in your theory but also very important question that you will be asked to interpret on an arterial blood gas in the afternoon session. We all know that Anion gap can be increased, either normal or decreased. Normal Anion gap is anywhere between 10 plus or minus 2. So as I told you, there could be increased anion gap, normal anion gap or decreased. So let us take a look on the increased anion gap. We use a mnemonic called mud piles, right? M for methanol, U for uremia, D for diabetic ketoacidosis, P for paraldehyde poisoning, I for intoxication, L for lactic acidosis, E for ethanol, and S for salicylate poisoning. So whenever you see a raised anion gap, think about these causes. So these are your high anion gap metabolic acidosis. For a normal anion gap metabolic acidosis, meaning your arterial blood gas has acidosis but the anion gap that is calculated is normal. So we remember these using a mnemonic called hard up, HARDUP. Now H stands for hyperalimentation, that is like fluids, example total parenteral nutrition, and hyperchloremic acidosis. A for acetazolamide, R for renal tubular acidosis 1, 2 and 4, D is for diarrhea, U is for uterosigmoidostomies, P is for pancreatic fistulas. So these are the normal anion gap causes. Now coming to the low anion gap causes, so the causes for the low anion gap metabolic acidosis, meaning arterial blood gas has acidosis but the anion gap is low. The causes are hypoalbuminemia seen in nephrotic syndromes, liver cirrhosis and pregnancy induced hypertension, right? Now it is also, now the terminology has been used, it is called as hypertensive disorders of pregnancy. Intestinal obstruction, multiple myeloma, lithium toxicity. So these are the causes for your low anion gap metabolic acidosis, right? And thank you so much for joining in, and as always, happy learning. Thank you so much.